Because I have quite a few classes that are probably going to watch this review, I want you to know that this is a rough estimate. You can expect anywhere from 100 possible points to 110. It all depends on the extra credit. For example, you all had a quiz that I said we will be applying that extra credit to depending on how you did. Not every professor has done that, so they might choose a different size test so that you all come out evenly in the wash, as we like to say, because we know some of you talk during tutor time. So rest assured the professors talk too, so we can try and keep you all on the same field, level field. You will have a test version where there are 110 possible points. It will be graded out of 105. And then on top of that, whatever points you got from your quiz will be added to your score. So when I post your score, it will have already included your quiz points. So you don't need to email me saying, "Did you already add it?" I will not post anything until it's all tallied. Okay? As you might have seen in your homework packet, there is a picture of a nephron with some descriptors, and you have to match the descriptions to the different parts of the nephron. That very same picture is the very front page of the exam. So, and it is labeled because that's heartbreaking when you all forget your anatomy. Anatomy was a prereq. Anyway, so there are about, depending on the instructor, there are about 10 to 15 questions on that picture. Moving on, yes, there are acid-base questions on this. We ask you questions like, if you consumed too much Tums, too many Tums, if you had too much sodium bicarbonate, what could that lead to? So do you remember the 2 slides from your acid-base lecture where we gave you in bullet form causes that can lead to respiratory and metabolic acidosis and respiratory and metabolic alkalosis? We also ask you questions about compensation for different types of pH disorders. Please remember, if it is metabolic, both the respiratory system and renal system can compensate. If it's respiratory, the renal system would compensate only. There are some questions about GFR. Not calculations. You never need a calculator on a lecture exam. No calculator should be out. You're not going to need it at all. So no calculations. But you should know your terms regarding GFR. Like, what is GFR? And you should probably go back and look at the first lecture where I started to introduce GFR, which was the filtration lecture. And that was what your quiz came from, remember? And some of you were confused about renal plasma flow versus effective renal plasma flow. So go back, please, and review that lecture. And also, the quiz is posted as well. I would look at that. I would also look at definitions that you saw on PowerPoints. For example, what is transport maximum? What is threshold? And as we discussed last week, there will also be acid-base problems that are similar to the 4 conditions where we had the modified Henderson-Hasselbalch equation. We had the pH with the up arrow or down, and then we had the base and the CO2. One was the problem, one was the compensation. Do you remember that? So there will be problems like that we addressed last week. You will be given a clinical problem where you have a person, and it depends on your test version. They might be overhydrated, they might be dehydrated. What could you tell me about their ADH levels, if they're overhydrated versus dehydrated? If they're dehydrated, what would happen to their renal blood flow, for example, versus if they're overhydrated? So, and I believe there are some sample questions like that in your homework packet as well. When I look at your homework packets tonight and check them in, when I see that page, I'll go, oh, pay attention to this page. That was the clinical problem that I was referring to. What does ICF stand for? Intracellular fluid. And what does ECF stand for? Extracellular fluid. So please understand those and understand how they can change with expansion and contraction. On the board, when I taught you about expansion and contraction, I drew different pictures than what was used in the PowerPoint. And I said, I think it's easier to see it here using red blood cells. And I used the red blood cells to represent size differences of the tissue cells. Right? So if there was ICF loss, cells would crenate. If there's ICF gain, cells would swell. So please review those pictures and understand how there are volume changes both intracellularly and extracellularly. Do you remember your shocks? I mean, general. What are the 3 ways a person can have shock, circulatory shock? There were only 3. Hypovolemic, vascular, and cardiogenic, right? Yep. So just remember those 3 general categories. Because, and why? Kara, why? We already had a test on Unit 3. Well, Unit 3, we talked about blood pressure being maintained on a short-term basis. Unit 4, we're talking about long-term basis, or long-term management of blood pressure, and that's the hormonal regulation. So we need to marry Unit 3 and Unit 4 in that regard. How does water move? Push or pull. Osmosis is what? Pulling. Thank you. That's what I was looking for. Matthew, you said push or pull, so I was like, so osmosis. Osmosis would be which one? Please review your diuretics and where they work in the nephron. And what do we mean by potassium sparing for some diuretics? What does the word diuresis mean? More water flow, more urine flow. And remember, we talked about diabetes mellitus, which means high urine flow of sweet taste, and diabetes insipidus, which means high urine flow of bland taste. Both of them have high urine flow, but for very different reasons. And we discussed those. I would review them. Why do they both have diuresis? What is the reason why they have more water exiting the body? Typo, but not drastic. Where is the most sodium reabsorbed? Good. Always, right? Where's the most glucose reabsorbed? Is it reabsorbed anywhere else? No. Is sodium reabsorbed anywhere else? Good. Where is the most water reabsorbed? Good. Is that the only place it's reabsorbed? No. There are other places, right? But I would review your percentages of how much of everything was reabsorbed and where. And then also look at that critically if hormones are around. Do hormones really affect the PCT? Not really. There was one that I gave you that does. There's one. Yes, I did. Tyler's looking at me like, yes, I did. Angiotensin 2 is the only one. So again, please review what would happen to a person's body and what hormones would be released if they were overhydrated versus underhydrated. And there is such a thing, by the way, as water intoxicity. You can die from drinking too much water. You can. And sadly, a lot of fraternities and sororities trying to escape getting in trouble from having hazing parties where they make the students that want to join them drink too much alcohol, because they get in trouble for that, especially if the inductees are underage. They have shifted to making them drink copious amounts of water, and students have died from that. So they're still under scrutiny. And just 2 summers ago, I can't remember if it was UCLA or USC. Was it USC? One of them up there, they thought, well, if too much water was bad, we'll just deprive them of water. So they made these, and they were young guys, they made these guys trying to get into a fraternity. They deprived them of water for 24 hours. Then they had minimum clothing on, no sunscreen, no shoes, and they were sent on one of the trails into the LA Canyons area with no water, nothing. Shock that one of them was found dead by the trail. So have we learned anything from this class? You cannot drink too much water too quickly. If your kidneys cannot compensate in real time, it can kill you. Water moves for what reasons? Push or pull. So you can have your brain cells swell from gaining too much water if you consume too much water too quickly. Students usually ask me, well, what's too quickly? I don't know. It all depends on how well your kidneys can compensate. Are you over age 30 like I am? Then they're impaired. If you're under age 30, I'd hope that they're not impaired. And how many kidneys do you have? How do you know? Are you sure? You assume you have 2. But my contractor who's doing my bathrooms for me had a kidney stone. They went in, and he went into the emergency room because he was in so much pain. And they did imaging on him. The doctor came back and said, yep, it's a kidney stone. And by the way, do you know you have a kidney? Singular. One. And he didn't know that. Didn't know that. That's a game changer. I mean, you start thinking, oh, I only have one.
Wait, it was just missing?
It was congenital. He didn't have one. It atrophied. I know. But we don't exactly take newborns and do imaging on them. Like, let's see if everything's there. No, we just look externally, don't we? Yep, let's see the genitalia. Let's see 10 fingers, 10 toes, 2 eyes. You know, we look for... How are the ears spaced? Is it too low in the neck? Is it a broad-shaped shield? We look at everything external. We don't look internal.
Yeah, you said if I'm not missing a bone.
You're missing a bone.
Yeah.
Really?
One in my spine, vertebrae.
Which one?
It was between like my thoracic and I don't remember. Thoracic and
So do you have spinal curvature problems? Is my question right back to you.
no.
Then if it's you're missing a bone between thoracic and
I don't remember.
okay, so honey, are you missing a thoracic bone or are you missing a lumbar?
I don't remember. I'll have to look. I just know one's gone.
Because if you're missing a thoracic, are you also missing a rib?
Oh yeah, no, I know.
Then, okay, I'm just going to move on. Next time, bring me with you to the doctor. I've got questions. Clearly you don't. You're like, cool, okay. No.
He's like, it's not a big deal. It just happens sometimes.
how did you find that out?
I pinched a nerve in my back, so I went and got it.
And you had imaging done?
Yeah.
Got it.
Mm-hmm.
Okay. Interesting. We all have anatomical anomalies. It's just a matter of when do you find out about yours. For example, I'll tell you one of mine. I have a third nipple. It's not uncommon. It's not. They're called accessory nipples or supernumerary nipples. And look at, just because I see all the wheels turning in your heads, no, it does not produce milk, nor has it ever. No. So if you look at your nipple line, it's actually quite common. About a quarter of you in this room probably have one, and you didn't know. You look in your nipple line, go up and go down in that nipple line, just like you are a cat or a dog. You might have a little mole, but it's not a dark mole. It's like a pink fleshy mole, and you're like, what is that bump? It's a nipple. It's a nipple. And when I learned about that when I was in graduate school taking anatomy, I was like, oh, I've always wanted to know what that was. And so when my teacher, I was chasing her down the hall, look, I got one. She's like, it's okay, I know, a lot of people do. So I thought it was so unique. Pretty neat, huh? Now you're going to go home and you're going to look. Okay. Please review your alpha intercalated cells and your principal cells. Principal cells are important for being a target for aldosterone, which helps us save sodium and water. But it's also very important for us to get rid of extra potassium. Remember, potassium should be low in the extracellular fluid. Alpha intercalated cells, if you go back to our hormonal regulation lecture, which you see on my recorded screen here, alpha intercalated cells are very important for when you're on a low potassium diet. They save it, and the way they save it is by using the hydrogen potassium ATPase. That ATPase has nothing to do with acid-base balance. The hydrogen ATPase has everything to do with acid-base balance. That's where we get our net gain of bicarbonate that I told you about last week when we finished our acid-base lecture. There will be a matching section of descriptions to the different hormones and chemical signals. This is already found in your homework packet where you had to match like aldosterone and ADH to descriptors. In the very first lecture for the renal system, it was actually a review of Unit 3. And it was a review of Unit 3 because it had everything to do with Starling forces. Starling forces explained filtration. Please review your Starling forces with respect to filtration across the glomerular filtration membrane. Hydrostatic pressure, colloid osmotic pressure, and please remember there's Bowman's capsule, or also known as glomerular capsule, and then the glomerulus, right? So we have hydrostatic pressure in both places. We have colloid osmotic pressure in the glomerulus, but we don't have colloid osmotic pressure in the glomerular capsule. That was the one that fell away. It disappeared. And then KF factor was still very important for filtration as well. That's the permeability. You took a trip through the nephron for a purpose. Please study your nephron. What processes occur at every step? At every place. In the glomerular capsule, we've got filtrate entering. In the PCT, what's going on? In the descending limb, what's going on? In the thick ascending limb, what's going on? The early and late distal convoluted tubule versus the collecting duct / medullary duct. There are about 10 to 12 questions on the expansion and contraction questions. Remember I said it was the beast of Unit 4 for the renal system. Please review the components of the juxtaglomerular apparatus. In that first lecture, you also learned about autoregulation. What are the parts? Oh, I've said it 40 times. What is the autoregulation? I'll give you one of them. The myogenic mechanism was one of them. So go back to that first lecture and refer or review what renal autoregulation is. What is obligatory water loss and what determines it? How can filtration and reabsorption be affected by changing our Starling forces? There were 2 slides in 2 different lectures where I showed you how R could go up or R could go down, and I said R did not represent radius. Instead, it represented resistance. And then on a slide that followed those pictures, I gave you little summaries of how that could change your filtration and your reabsorption. And also there was a third one for secretion. Respiratory system. Yes?
Sorry, I missed that last point after the obligatory water loss. You said something about filtration and reabsorption.
Yeah, review your Starling forces and how they can be changed to alter filtration rate and reabsorption. What can change from moment to moment and why, I guess, is the better way to say that. If you go back and you look at that first lecture, you're going to go, oh yeah, radius. So, about 85% to 90% of the exam is from the renal lectures. Only about 15 to 20% are respiratory. Why is there overlap? Well, because the acid base is kind of an overlap, isn't there? Where it's respiratory and renal that we have to consider. But the focus is definitely renal on this exam. Why? Because the last lecture on external and internal respiration, I said, would not be on this exam on Wednesday. Instead, I would put it all on the final exam to give you more time to practice oxygen hemoglobin dissociation curves, which is part of the reason why we're here tonight, having a meal together, and we're going to start talking about that next. So what part of the respiratory system is on Wednesday's exam? You can expect the mechanics of ventilation, how do we breathe, and the work of breathing. And it's quite simple. Go through the PowerPoint, look at your homework packet, look at the questions that pertain to those lectures, review your pulmonary diseases, review Fick's law, because that's part of the problem with the respiratory diseases. Chronic bronchitis versus asthma, and when I went through the work of breathing, I highlighted them. But go back and look at those again with the twist of how is Fick's law impaired with those. What does compliance mean? When are the lungs compliant? When is the chest wall compliant? What do we mean by recoil? Which way are the lungs going when they recoil? Which way is the chest wall going when it recoils? So I just say, look at those 2 PowerPoints, go through them slide by slide, and make sure you understand how we breathe and focus on each of the respiratory disorders that we highlighted. Okay? There is a word spell. There is also a relationship problem. So expect both of those. You did not have a word spell last lecture exam, but it's back for this. Are there any questions? Okay. Well, then get more food.
What?